Mental health has become a prioritised topic of conversation amongst both individuals and boardrooms following COVID. With an increasing proportion of the population suffering or likely to suffer from poor mental health, we believe Saha's unique preventive approach, leveraging proprietary technology to provide deep insights with actionable responses, will help individuals and communities have a tremendous impact in tackling this major global issue.
Hi, my name is Doug, and I'd like to introduce you to Saha. Mental health is the classic iceberg. Most of the impacts are hidden. Did you know that 264 million people will suffer from depression this year, costing the global economy over $1 trillion in treatment and productivity losses? The impact of this lack of awareness is reflected in delayed diagnosis and treatment, resulting in higher costs for organizations. Remember the iceberg. Indirect costs, which are difficult to assess, are 350% higher between treating mild and severe forms of depression, illustrating how important it is to catch depression early. So what is the solution? Saha is a predictive mental health app that informs the user if they are at risk of depression. Saha leads in three important areas. First, it provides early risk depression using leading indicators, not lagging like surveys or questionnaires. And Saha is unobtrusive. It asks instead of how you're feeling, it assesses how you're feeling. Social support. Saha is a unique feature whereby it can ask your friends to call you. In my roles leading global digital teams, we had worked with Facebook and Google to mine behavior and interest to glean purchase intent. This was our inspiration for Saha, applying that same capability to learn more about ourselves. Using our phones, we can collect behavioral markers such as staying at home, sleep, linguistic patterns, and assess them to help determine the mental health state of a user. This early assessment leads to early intervention. Early intervention leads to less impact on the user and less time in treatment and less cost. Saha is evidence-based, based on our relationships with University of Otago and with the Dortmund University. My co-founder, Alex, has formed 3 other startups to Saha and has successfully fundraised in the past. We have secured 4 LOIs representing over 12,000 users and an ARR of $432,000. Organizations that have signed our LOIs validate our assumption that businesses will invest in this type of solution. The predictive mental health space is new, but using the mental health treatment space as a guide, we are forecasting a SOM of $125 million. Our initial go-to-market strategy is focused on B2B, specifically organizations with the duty of care, such as schools, defense, and hospitals. This market is substantial, representing 17,000 institutions with over 55 million individuals. Our LOI with Otago Polytech illustrates the validity of this model. Given the size of the market opportunity and our advantage in the predictive mental health space, we are forecasting strong year-over-year growth, culminating in an ARR of $90 million by year 5. The predictive mental health technology space is being defined, and as a first mover, our roadmap reflects our ambition of defining the space. We are launching an app in September and a dashboard to assist institutions to tailor interventions and determine outcomes in December. 2022, we plan an indication expansion and data platform. Our team demonstrates the depth and experience and knowledge required to execute on our plans. The timing for this solution is now. With my experience in strategic partnerships and product development and Alex's startup experience and tech knowledge, we feel that we are the team to capitalize on this opportunity. And to that end, we are looking for investors for our SAFE round, closing in Q3 this year, as well as advisors and customer introductions. Thank you so much for your time today.